Assalamu alaikum. Our lecture in pathology or musculoskeletal disease is about bone tumor. Bone tumors develop when cells within a bone divide uncontrollably, forming a lump or mass of abnormal tissue. Most bone tumors are benign, that's to say not cancerous. Benign tumors are usually not life-threatening and in most cases will not spread to other parts of the body. Depending upon the type of the tumor, treatment options are wide-ranging from simple observation to surgery to remove the tumor. Some bone tumors are malignant, that's to say cancerous. Malignant bone tumors can metastasize or spread through the body into other parts of the body. In almost all cases, treatment for malignant tumors involving a combination of chemotherapy, that's to say drugs, radiation, and surgery. Bone tumors can affect any bone in the body and develop in any part of the bone from the surface to the center of the bone. Center called the bone marrow. A growing bone tumors, even a benign tumor, destroy the healthy tissues and weaken the bone, making it more vulnerable to fractures. When a bone tumor is cancerous, it is either a primary cancer or secondary bone cancer. A primary bone cancer actually begin in the bone, while secondary bone cancer begin somewhere else in the body and it is metastasized or separate to the bone. Secondary bone cancer is also called metastatic bone disease. The type of cancer that begin elsewhere and commonly spread to the bone include breast, lung, thyroid, renal, prostate. Now, we will speak about the primary bone cancer. The four most common types of a primary bone cancer are, first of all, multiple myeloma. Multiple myeloma is the most commonest primary bone cancer. It is malignant tumor of the bone marrow, that's to say the soft tissue in the cancer of many bones that produce blood cells. Any bone can affected by this cancer. The second one is osteosarcoma. This is the second most common primary bone cancer. It occurs in 2 to 5 people per million each year, with most cases in teenagers and children. Most tumors develop around the knee in either the femur, that's the thigh bone, or tibia, the shin bone, and other common locations include the hip and shoulder. The third tumor, this is the primary, still we are speaking on the primary tumors. Ewing's sarcoma. Ewing's sarcoma usually occurs in the patient between the age of 5 to 20. The most common locations affected are the upper and lower leg, pelvis, upper arm, and ribs. The fourth one is chondrosarcoma, the malignant tumor composed of cartilage producing cells. It is most often seen in patient between the ages of 40 to 70 years. Most cases occur around the hip, pelvis, shoulder areas. Now, the benign tumor. There are many types of benign bone tumors, as well as some diseases and conditions that resemble bone tumors. Although these conditions are not truly bone tumors, in many cases they require the same treatment. Some common types of benign tumor, bone tumor, and conditions that are commonly grouped with tumor include non-ossifying fibroma, unicameral simple bone cyst, osteochondroma, giant cell tumor, enchondroma, fibrous dysplasia, chondroblastoma, aneurysmal bone cyst, osteoma. The causes of tumors for most of bone tumor is unknown. The symptoms of the patient with bone tumors will often experience pain in the area of the tumor. This pain is generally described as dull and aching. It may worsen at night and increase with activity. Other symptoms of bone tumor can include fever, night sweats. Many patients will not have any symptoms, but will note a painless mass instead. Although the bone tumors are not caused by trauma, an injury can sometimes cause a turnover to start hurting. Injury can also cause a bone that is weakened by a tumor to fracture or break. This may be severely painful. Occasionally, benign tumors may be discovered indirectly when an X-ray is taken for another reason, such as sprained ankle or knee injury. We will stop here and we will complete the lecture in the second lecture. We may show you some pictures of the tumor. This is the tumor of the bone. This is the growth, abnormal growth of the bone is a tumor. This is an X-ray. We will see you see that in the second lecture about tumors. This is osteosarcoma. We'll stop here and complete in the second lecture. Thank you.